We begin tonight with a 5-year-old boy who returned from West Africa who is being tested for Ebola. His results are expected soon. According to police, the boy returned from Guinea on Saturday with his family, and the first person to be diagnosed with Ebola in New York City, Dr. Craig Spencer, heads into the next and more serious phase of his illness. Meanwhile, officials released the nurse today whom they forcibly quarantined in New Jersey for Ebola observation. Under a recently announced state policy, Casey Hickox was being held against her will in an isolation tent at a New Jersey medical center. Hickox had returned to the U.S. after treating Ebola patients in West Africa. She was confronted with a strict new mandatory quarantine policy, which many are criticizing. Arise News correspondent Shahan Ramkissoon is here with the latest. Hi, Shahan.
Well, David, the United Nations has blasted restrictions placed on healthcare workers returning from West Africa. It says creating unnecessary difficulties for medical professionals who are risking their lives in the battle against Ebola. Nurse Casey Hickox has described her treatment at a makeshift isolation tent at Newark Airport as inhumane and needless. And the United Nations agrees, slamming compulsory quarantine measures introduced by the states of New York, New Jersey and Illinois.
The Secretary General is concerned by the recent restrictions put in place in several countries and localities applying to people who have traveled to the main Ebola-affected countries. Returning healthcare workers are exceptional people who are giving of themselves to humanity. They should not be subjected to restrictions that are not based on science. Those who develop infections should be supported, not stigmatized.
Hickox was released after testing negative for Ebola. She will be monitored at her home for the next 3 weeks. Fallout from her airport quarantine has led to New York clearing up its rules.
From an operational efficiency point of view and from a safety point of view, the preferred option is to ask them to stay at home. The healthcare worker will come to their house twice a day. They can have their family, whoever is normally there. It's not that they're stopping their life.
Meanwhile, the U.S. Army Major and 10 other personnel are being monitored in Italy after returning from West Africa. The Pentagon says they'll be isolated for 21 days at a military base, but officials refuse to admit they are under quarantine. Debbie?
Shahan, going back to this 5-year-old who traveled back from West Africa with his family, is there any news about his status?
Well, a few minutes ago, there are some reports saying that those tests have come back as negative, but we'll have to wait for officials to actually come out and give us those results. They did say that it would come out sometime this evening, so we'll have to get confirmation on that, Debbie.
All right, and we will report that as soon as we have the confirmation. Meanwhile, the CDC is coming out with yet more guidelines. Update us this time.
Well, the CDC is now saying people who have traveled to West Africa will have to face mandatory quarantine for 21 days, but they're not going as far as putting them in isolation at a hospital. Instead, they can be isolated in their homes. This is, of course, in response to the New Jersey governor putting that nurse in quarantine at Newark Airport. So lots of controversy after that. So that's the difference between the CDC guidelines and that of the New Jersey state.
Yeah, and there's a lot of controversy over governors, not just of New Jersey and New York, but also, I believe, Maryland and Illinois. People believe they're overacting in some cases, don't they?
Yeah, they do believe so, and also quite a political thing, most people are saying. Everyone's trying to win over support ahead of elections, and that's why they're taking such drastic steps. Lots of medical professionals are saying they are overreacting, especially since the nurse in New Jersey did not show any symptoms of Ebola when she was forcefully quarantined.
Shahan Ramkissoon reporting for us. Thank you, Shahan. For more on the New York medical response to Ebola, we turn now to Dr. Aletha Maybank. She is the Associate Commissioner for the New York City Health Department and Director of the Department's Center for Health Equity. She's here in our studio. Hey, Aletha, it's good to see you. First of all, the Department of Health has been preparing for this for months. What has the city been doing to prepare for a possible outbreak of Ebola?
Right. So since March, when we really heard about what was happening in West Africa, we've been following since then. When July came around, it was quite clear that the epidemic was definitely increasing and that we needed to focus a little bit more efforts on our preparedness as a city and started to really ramp up our efforts. And it wasn't just the health department, but it was really other agencies that are really going to have a role in response across the city. a couple weeks ago, probably about 4 weeks ago, we really, activated as a health department to really mobilize, restructure so that most of our energy and a good part of our energy was focused on how are we going to respond if a case comes. And so that involves working with other city agencies, working with the mayor's office, working with hospitals. We made sure, we had to put and create a lot of protocols, a lot of training. We were able to learn a lot from the Dallas and what happened there, and also what's happened at the other 2 hospitals that folks have been treated in the country, in Emory as well as in Nebraska. We worked with other health providers across the city, and a big part of our outreach has really been a focus on the West African community, because we know that there's a possible, because they're going back and forth, of that community really having the greatest risk of potentially coming back to this country or having some level of exposure to Ebola. Even though it's still extremely low, that would be the greatest risk. And so we've had plenty of conversations really directly with communities across all 5 boroughs, trying to understand, what are the best pathways of communication? What are your concerns? What's going on? And this is really where we've heard a lot about stigma. And the growing stigma and the concern for discrimination that West Africans have been experiencing.
I want to go back to the preparedness. Of course, Bellevue Hospital is one of the designated hospitals to treat an Ebola patient. That's where Dr. Craig Spencer is being treated, also where this little 5-year-old was being tested. How many hospitals here in New York City are specifically designated to handle an Ebola case?
Sure. So Bellevue Hospital is still the key first hospital that we go to. However, there's 4 other hospitals in New York City that are designated to be able to treat an Ebola patient, and they have been in the preparation process. They are preparing, and they are almost all completely ready to definitely take on a case.
I would imagine being prepared, it comes down to resources, right?
It comes down to a lot of resources. It takes a lot to be able to care for an Ebola patient on many levels, from the frontline staff as soon as you walk in the door to everything else that happens. I think the important thing also is to understand that in New York City, even if it's not a designated hospital, we've been working with all hospitals, and all emergency rooms have the ability to identify and isolate and then evaluate, call the health department, and then if this patient needs to be transferred, we can transfer to another hospital.
As we reported at the top of this segment that Dr. Craig Spencer is entering a more difficult phase of this disease. Can you give us an update on his condition?
So far, as much as we could say, he's in stable condition, and he's doing what's to be expected as far as for the disease, for Ebola and its progression at this time. The concern and why Ebola is such a deadly disease if you're not put in supportive care early is because folks can lose anywhere from 10 to 15 liters of fluid a day.
I want to jump in there because I'm all out of time, so just in a couple of seconds. As a doctor, what's your knee-jerk reaction to governors like the governor of New York and New Jersey instituting this mandatory quarantine, which doesn't follow the science?
Right, and that's what we always go back to, as the health department. And it's very important in a time like this that we do focus on the science. We do focus on what it is that we understand about this disease, because our ultimate role is to protect the people's health, but we need to follow the science.
All right, Dr. Aletha Maybank, thank you so much. Good information. Appreciate it.